Hey, good morning, everybody. So we're just going to do another vlog today. Number one, I hope that everybody's enjoying the vlogs. If not, we should cut it then. Cut it meaning stop doing vlogs. So I'm getting a few responses, but not the type of responses I was hoping for. Like, hey, well, do this or do that, or thank you, etc. So today, one of the things that I read about a lot is healthcare. How's healthcare here in Nicaragua? So I'm going to give you my perspective, and then I'm just going to talk in general terms. So from my perspective, based on some tests I've been doing in the past 2-3 weeks, I have a medical issue, and the issue is related to potential stroke, etc. So I had a stroke 6-7 years ago, and I'm starting to feel that it's coming back up. So I've been getting some tests, and it seems that I have a clot in my artery in the neck. Not a clot, but a plaque, whatever they call it. So I went to a local doctor in Granada, awesome technology he has there, did some testing. Then they did ladies, when they go and check how the baby is, etc., they did it here in my neck. I don't know what the name is of the machine, so sorry guys that sometimes I don't know the technology, but they did it, and in fact I do have plaque or clot, whatever they want to call it, at approximately 50%. Hey, I'm still alive, I'm still ticking, so good for you, right? So yesterday I decided to go for a second opinion, and so I went to Pella. The Pella doctors and the Canada doctor equal cost for a heart, a cardiovascular doctor, surgeon, right? So the visit was $50, okay? Then they recommended I get 3 tests. One is a brain scan with dye. So this goes in an imaging, those round tubes, right? Where if you're claustrophobic like I'm already going, no way. But okay, that's not what you wanted to hear. So got a price for that. The imaging brain scan is going to be $650. Then I asked, the doctor asked for a heart scan in the same type of imaging, and that was $1,000. Then I still need to get the vascular, so your veins, etc., reviewed, and that is going to be also close to $1,000. So, you're talking $4,000. Heck, if you compare that to the U.S., knowing some of the tests I've had in the U.S., you are looking at the bare bones $15K. Okay, so I am now debating what route I'm going to do. Do I do all 3 tests, or do I do the one that I think is important, which is the vascular, the veins? So I haven't decided that yet. So the other one that I know about medical-wise, my wife, Ghislaine, she had a fall and cut right above her eye and needed immediate stitches, immediate care, because she was bleeding terribly. So what did we do? Well, we took her to the emergency hospital in a small community in Diria, and there basically she walked in, and they laid her down. I checked all the stuff that they were providing. The needles were clean, they used gloves, they had masks on, the whole 9 yards. So that went well. We then called a plastic surgeon 3-4 months later, visited the plastic surgeon in Managua, and he basically goes, I don't know who did that work, but that was amazing work. Amazing work, okay? So the cost for that emergency was zero, because we live in the community. However, we did pay for the, how you call it, the items used so they could replenish, and we gave some extra for the services, so as we call it, you know, so they could go buy their pancito. Pancito means to get a piece of bread, but really it's just helping, okay? So, you know, again, try to go to an emergency room in the U.S. You got the emergency room fee that I remember when I went to the emergency room, that was a few $1,000s. So go ahead and compare. Then my brother-in-law had an accident and cut his finger right here, and right by the joint. And again, we went to the same clinic, and they sewed as good as they could the two tendons, and then they told us to go to Masaya to see a specialist to help. Again, went perfect, went well. Again, no cost, but again, we pay for the items that they're using, so they can replenish, right? So you help out. So overall, our experience has been A plus. I have no objections whatsoever to get my health care. Ghislaine also had a breast reduction, and that she did at a hospital in Managua, not Vivian Palace. The doctor that she used was a doctor that had rights at Vivian and Bustamante. So he basically says, where do you want to go? Vivian, you get the Cadillac rooms and Cadillac this, cost you more, or you go to the other one, it's going to cost you 20% less. You know, we decided, hey, we got the doctor, we got the same room, operating room, he feels comfortable, so why don't we try a more of a Nicaraguan experience? Again, fantastic. I mean, I was not under the knife, but I know from the experience that Ghislaine had, the service we got from the nurse, she needed to stay over. She had a great room. They even brought me breakfast. Try to do that in the U.S., where they bring you breakfast to the room. So that was amazing. That, to me, was a great touch. You know, sitting there watching TV and they say, "Do you want breakfast?" Yeah. Here's the menu. Go call. I did. I had a great breakfast. Don't tell anybody, but I did have a good breakfast. So basically, that is my experience. Healthcare, people say get some insurance, but the insurance here is what I call a discount. So I told you I went to the doctor at Vivian yesterday, and the total cost, if I do everything that they're saying, let's say it's $5,000, right? You're going to get a 30% discount. Okay, it's $1,500, right? However, to get the insurance is going to cost you approximately $100. So you multiply that, you know, it's in a year and 3 months, I'm at break even. So what I do, I put the money aside, and when I need service, I just take care of it. So there is really not insurance here, but there are discounted insurance programs. Well, I hope I gave you some great thoughts about the medical care here. I, Ghislaine, her brother, and others that have used the services here are very pleased. And dental care, I didn't say that. Dental care is great. Yeah, I even get dental care done at times with no Novocaine. Yes, me with no Novocaine. And that has gone good, lower priced. You know, where you pay for a crown between $250 and $300. In the U.S., you're in the $1,000 or more. So I hope this helped. Have an awesome day. Take care. Leave a comment. Tell me what else do you want to know. Thanks.